Hello everyone, I'm Dr. Rahul Reddy, and today we'll be talking about how should your child with type 1 diabetes maintain the blood sugar diary, which is also called a monitoring diary. So self-monitoring of blood sugar at home becomes a very big important aspect of type 1 diabetes management. Now, what are things that we should record in a monitoring diary? First thing is the blood sugar level, second is the insulin dose that is being given, and third is the food that the child has taken. Now, normally, if a child is on a basal bolus regimen with a rapid or short acting insulin and a long acting insulin, one needs to monitor their sugar levels before breakfast, before lunch, before dinner, and bedtime. So, 4 times a day monitoring of blood sugar diary is the minimum when somebody is on a basal bolus regimen with a rapid acting or short acting along with a long acting insulin. Now, here we need to record what insulin dose was given of the rapid acting or long acting insulin before lunch, before dinner, and before breakfast, along with the blood sugar and the insulin that was given. We should also write down what is the diet that the child had, what food the child had for breakfast, lunch, and dinner. In addition to this, if a child also has snacks after breakfast and after lunch in the evening time, it can be mentioned here in these columns. Additionally, if the child has received any further doses of rapid acting insulin in the snack time, it can also be mentioned here, along with the blood sugar level if it was measured before giving the snack. So, a child with type 1 diabetes, although it's difficult for the parents and the child to monitor their sugars 4 times a day, it becomes really important to monitor it 4 times a day for the best results and so that we can manage the child's type 1 diabetes well without any complications in future. Now, after writing the three things, the blood sugar, insulin, the food, we will have a complete idea of what was the trend of the sugars during for one day. And similarly, we should continue that for the next day by mentioning the date here and continuing the recording of these three things. Once you have a few days readings like this, and once you have it on the diary, it becomes rather easy for you to decide how much dose of insulin to give during the following days. By this way, we can avoid hypoglycemia and hyperglycemia and manage the child's diabetes well by maintaining the sugars in the normal range. With this, I will end this video. And as I said before, there's a link for downloading this sheet and for you to use in the description of the video. Thank you.